Hello, good morning. This is again Dr. Moses from Pacesdiaries, and I'm going to demonstrate a couple of things that made candidates fail in the communication stage. The very first thing the candidates do that actually fails them in case of a communication scenario is not reading the scenario properly. The scenario will be given to you in a piece of paper and you will be made to wait outside for 5 minutes. Using the 5 minutes, read the scenario properly, take a piece of paper and take a pencil and then note down that what is the relevant thing. See the task at the hand and make a plan. If you fail to do that and if you're going to rush all the way, okay, I have seen something, maybe I just have to examine about the lumbar puncture, or this is a case of a DNA CPR, all right, I'll just go and tell whatever it is. By missing out certain fine details and not having a proper plan is the very first reason many candidates fail. Yeah, tell me what happened.
Yes, sir. It's been over 10 days that my grandfather's been admitted in the hospital. He's in the ICU. Nobody's giving me any information about him. Like, he's been over here for 10 days. Nurses come, tell us random things. There's no concrete information about anything. When are you going to give us this information? We've been asking you for days now. There's nobody coming giving us. Every day a different doctor comes, tells us something. Nobody's giving us a concrete information about what his health is. Are you listening, sir?
Just you have seen what has happened. There was a patient, a surrogate, is genuinely worried about his grandfather's health. On the other hand, you have seen the candidate, a PACES candidate, and the way he was sitting, the way he was talking, the way he was listening. This is the wrong way of approaching a communication station, which will fail. Communication is two-way. You have to listen first. And for that, your posture should be very, very appropriate. You should sit in a proper way. You should keep an eye contact. You should listen. And you should empathize. Your body language should speak more than your words. When you fail in this thing, if you sit inappropriately, if you are not keeping an eye contact, you're randomly moving around and fidgeting around, that will put a very wrong impression. All right? Do you know there is a fact? At the end of a communication scenario, examiners do turn to the surrogates and ask, how did he perform? They can give you thumbs down. Then you're gone in that station. All right? This is the first red flag in communication.
Doctor, what is happening to my sister? I don't understand. No one's telling me anything. Can you please tell me what's happening to her?
Yes, she's suffering from optic neuritis. And we have diagnosed her as a case of multiple sclerosis. According to the records, she was suffering from quadriplegia previously. And this time she's been coming with visual loss. And we have diagnosed optic neuritis. We have done an MRI on her. And that shows Dawson's fingers and there are a few white matter changes. And we might need to do a VEP and oligoclonal bands on her.
Doctor, I didn't understand anything.
This is another red flag sign in the communication scenario. Using jargons and complicated language. Always use simple language to the patient which the patient can understand. Never ever use any medical terms or words which the patient does not understand.
Doctor, how's my grandfather? He has been here in the ICU for the past 7 days and there's no improvement which I can see.
Yes, he is sick. He's pretty critical. I hope you should understand by now. You brought him late, first of all, and we don't have any magic. It will take its own time to get better. If you want, you can continue the care here. This is the maximum which we can do. If not, you can take him elsewhere. That's all I can do. This is called verbal roughness. You should always be careful about the prosody of the voice, the way you talk to the patient party. If any point of time you speak badly to the patient or there is a verbal roughness, you will be marked negative in patient welfare. And that is the skill which you have to score the maximum, and you losing even 1 mark out of the patient welfare might be very critical for you in the PACES stations.
The other two things why candidates fail in PACES examination is when they fail to address the concerns. The concerns time is 2 minutes. You get a warning both in the clinical consultation station and as well as your clinical communication station. Many a times I have seen candidates going and examining the patients when they said 2 minutes left. And many a times they will be taking history or explaining something. No, don't do that. The moment you get a 2-minute warning, just stop whatever you are doing and just address the concern. Address the concern in a short and a simple way and make sure there will be around 3 to 4 concerns for you to address. So keep the explanation extremely simple. That's number one. The second thing, what happens is failure to elicit a proper history. Many people ask, should I take a history in communication? My mentor told not to take history. My guru told not to take history. My boss told not to take history. No. You have to take history when it comes to something very appropriate. I'll give an example. You're going to talk about a scan that involves a contrast agent. You have to ask whether the patient is pregnant by any chance, if it's a lady. You're going to face a patient and you're going to break out a diagnosis of epilepsy. You have to ask about driving. So these are very important. I just gave you some examples like that. Social history. Maybe you're dealing with a case of an Alzheimer's. You have to talk about the social history. It's extremely important. You have to ask whom he or she is living with. Does she need any support? So these are some gray areas that needs to be addressed. So history taking, if you fail to take something relevant for the case, then that will be marked against you. All right? Thank you.